A lot of you started following me after my recent video about AFib, so it seems like this is a topic you want more information on. That video broke down what AFib is, what causes it, how it leads to heart failure, and treatment goals. I'll link that video in the comments so you can go watch it if you want. In this video, I'll discuss AFib and how it specifically relates to stroke. I'm Danielle and I'm a registered nurse. Patients with heart conditions like AFib and stroke patients were our primary focus in the hospital unit I worked on, so I have a lot of experience caring for both. I take complex medical conditions and break them down into human words. My goal is to empower you to understand and take charge of your own health. In this video, I'll briefly explain what AFib is, I'll describe how it causes strokes, and then I'll give you the 3 options to decrease your risk of stroke if you have AFib. If you're a just give me the basics kind of person, then you can stop the video there if you want. But if you're a I like the details kind of person, then I'll dive more into the specifics of each stroke prevention method and other risk factors that compound your chance of stroke. Let's start with what is AFib. AFib is short for atrial fibrillation. It's a common abnormal heart rhythm. Instead of the heart beating in a nice regular pattern, the electrical signals become chaotic and irregular. Those chaotic signals cause the atria, the upper chambers of the heart, to quiver or fibrillate instead of squeezing effectively. You may have also heard of a flutter or atrial flutter. It's very similar to AFib, and everything we're talking about in regards to stroke risk applies the same way. So how does AFib cause strokes? Because the atria don't squeeze effectively, blood can pool inside the left atrium, especially in a small pouch called the left atrial appendage. When blood sits still, it's much more likely to clot. If one of those clots breaks loose, it gets carried along with the blood into the left ventricle. Then the left ventricle pushes that blood, including any clots, to the aorta, which is like the main highway that distributes the blood to the rest of the body. Some of the very first arteries off of the aorta highway go to the head and the neck, and those arteries branch off to other, narrower vessels that supply blood to the brain. If a clot travels into an artery that's too small for it to pass through, it can get stuck in any of those vessels along the way and block blood flow to the brain, which means that everything beyond that point won't get blood and therefore oxygen, and that tissue starts to die. This is called an ischemic stroke, aka cerebral vascular accident or CVA, aka brain attack. Symptoms will be correlated to the part of the brain that is damaged and which part of the body or body function that it controls. For example, if the stroke affects the area that controls speech, speech may become slurred or difficult to understand. If it affects the area that controls your right arm, that arm may suddenly become weak. This is why it's so important to recognize the various signs of a stroke and get immediate medical attention, because every second that passes is more tissue death. Literally, time is brain. A large stroke can cause permanent disability or even become life-threatening. But lesser strokes may be reversible if you can get to a stroke center and get treated in time. So how do we recognize a stroke? A quick way to remember the warning signs is the acronym FAST. F is for face. You might notice facial drooping. A is for arm. You might have arm weakness. S is for speech. You could have difficulty speaking. T is for time. Time to call emergency services. Now, sometimes blood flow to the brain is actually restored before permanent damage occurs. The stroke symptoms resolve and no permanent stroke damage would be seen on an imaging at the hospital. This is called a TIA, a transient ischemic attack, sometimes called a mini stroke. But TIAs shouldn't be ignored just because the symptoms go away. This is a warning sign that you are prone to clots forming and are likely to have a legitimate stroke in the future with no way to know how devastating it may be. So if I've scared you enough, let's talk about how we decrease our risk of a stroke. We have 3 options. Number 1, get out of and stay out of AFib with a cardioversion, ablation, and/or medications. Number 2, use blood thinning medication to prevent clots from forming. Or number 3, get an implanted device like a Watchman to prevent clots from forming. So that's the down and dirty of it. You can shut the video off here if you're satisfied with this information. I'll take a couple more minutes to go over more details about those 3 stroke prevention options, and then wrap it up with a few other common stroke factors that will compound your chance of having a stroke. Let's go. Option 1, get out of AFib. The most straightforward way to decrease your risk of stroke is to simply not have AFib. Talk to your cardiologist about cardioversion or an ablation. Ideally, you would convert to normal sinus rhythm and stay in sinus rhythm, and then you're less likely to form those blood clots. There are also a variety of meds that you can try. Sometimes it takes a combination of them, and sometimes the meds can actually give the aforementioned procedures a better chance of sticking. For many people, restoring normal rhythm is the goal. For others, depending on things like age, symptoms, other health conditions, and how long they've been in AFib, the safest plan may actually be to stay in AFib while controlling the heart rate. In that case, we consider the next two options. Option 2, blood thinners. If you're stuck in AFib, then ideally you should be anticoagulated using a blood thinner. The most common blood thinners that you would take in a pill form at home are Xarelto and Eliquis. These medications suppress the clotting factors in your blood so that blood clots are less likely to form. Fewer clots means less chance of stroke. There are two important things to consider while taking this medication. One, it's important to take the pills as prescribed because missed doses can give clots a chance to form and extra doses can increase your risk of bleeding. And two, reduced clotting factors means that your blood won't clot even when it's supposed to. This means that you're at higher risk of GI bleeds and other internal bleeding, including a brain hemorrhage. Statistically, brain hemorrhages tend to have a higher risk of death than ischemic strokes. This is why people at high risk of falls or other trauma should have a conversation with their doctor to weigh out the risk of ischemic stroke versus the risk of a brain bleed. Option 3, LAA Occluders. For those people that decide blood thinners are not ideal, or those advised by the doctor not to take them due to a genetic clotting disorder or other reasons, there is a non-pharmaceutical option to lower your chance of blood clots forming in your heart. Earlier, I mentioned the left atrial appendage, the LAA, where blood can pool and form clots. So the idea is that by blocking the LAA, the probability of a clot forming decreases significantly. There are a couple of minimally invasive LAA closure procedures that do this. The Watchman device was the OG way to do this. If you've ever had a cardiac catheterization, this process is done in a similar method. A puncture is made in the right groin, and a catheter is inserted into the femoral vein and guided up to the heart. It enters through the inferior vena cava and into the right atrium of the heart. Then it pierces the septal wall, entering the left atrium. From there, it deploys a special kind of mesh at the opening of the LAA. Over the course of a few months, the tissue grows around the mesh and completely closes off the LAA. However, patients should be anticoagulated for at least 45 days surrounding the procedure, so it's still not a viable option if you're unable to be on blood thinners. A newer device, however, called an Amulet, is the same concept except the device immediately seals off the LAA, so you won't need long-term anticoagulants for AFib afterwards. You will need a different type of blood thinning medication called an antiplatelet for a while, but for many people that's okay even if anticoagulants are not. It's a conversation worth having with your doctor. Finally, let's discuss other stroke risk factors. AFib significantly increases your risk of a stroke, but there are plenty of other things that compound this risk. Some are out of our control. We call these non-modifiable risk factors, like being born female, especially since pregnancy and hormonal birth control specifically increase risk of blood clots. Being older, the chance of having a stroke actually doubles every 10 years after the age of 55, or certain genetic clotting disorders, including sickle cell disease. Other things we have more control over. We call these modifiable risk factors. High blood pressure is actually the leading cause of stroke. Extra cholesterol can build up in the arteries and make them more narrow, which can make it easier for blood clots to get stuck, like we talked about earlier. So high cholesterol puts you at a higher risk of stroke. And diabetes also increases your risk of stroke. Unfortunately, due to differences in access to healthcare and a higher likelihood of having conditions like high blood pressure and diabetes, Black Americans are almost twice as likely to have a first stroke as a white person and also more likely to die from one. And then things like poor diet, physical inactivity, obesity, smoking and tobacco use, and excessive alcohol intake can damage blood vessels and indirectly increase your stroke risk by increasing the chance that you develop high blood pressure, high cholesterol, and diabetes, the three highest modifiable risk factors. AFib already significantly increases your chance of having a stroke. All of these increase it even more. How many of them apply to you? Just something to think about. Quick recap. When you're in AFib, your heart beats irregularly and doesn't squeeze efficiently. Clots are more likely to form in the left atrial appendage and can travel to the brain and cause a stroke. You can decrease your chances of having a stroke by either converting out of AFib, with meds, a cardioversion, or an ablation, by taking blood thinners, or by getting a left atrial appendage closure device. So if you have AFib or Aflutter, that's the lowdown on why you're at a higher risk of stroke and how you can decrease your chance of having one. If you'd like more personalized education, I do offer one-on-one consults. You can find the information on that in the description below. You can find more videos with clear, practical explanations about AFib and other cardiovascular conditions like heart failure on my channel. If you click that subscribe button, then you'll be notified the next time I post one. And let me know in the comments if there's a topic you'd like me to cover.